Good afternoon, everyone, and thank you for joining us at this press conference by the Special Rapporteur on the Right to Health, Dr. Tlaleng Mofokeng. The Special Rapporteur will be briefing you today on the health situation in Gaza. She will begin with a brief opening statement, and then we will move on to your questions. And with that, I hand over to the Special Rapporteur.
My name is Dr. Tlaleng Mofokeng, and I welcome this opportunity to speak here today in my capacity as the UN Special Rapporteur on the Right to Health. We have watched the horror of a genocide unfold over the last months, representing yet another many episodes of a display of a recalcitrant attitude of an occupying regime and its allies, and on the other hand, an indomitable commitment to the right of people to exist, the right to health, and the autonomy of the Palestinian people amidst this in real time ongoing Khorasan violence. The timeline of the creation, occupation, siege, and annihilation of the Gaza Strip was already horrific before October 7th, 2023. The Gaza Strip is not a natural geographic unit. It is the hallmark of the engineering of apartheid, which is inherently violent and enables the genocide we witness today. Gaza became the laboratory for surveillance, weapons, and population control for decades. The Gazan population have not enjoyed a day of peace and justice since 1948. The power dynamics at play are not exceptional to Palestine. They are recognizable the world over as colonial and imperial manifestation of what happens when the dehumanization of entire populations is allowed to happen without any respect of any international human rights law and happens with impunity. When human rights are treated like an a la carte menu by member states and not what they truly are, which is indivisible, foundational, and unconditional, and the absolute language of obligations and accountability. The occupied Palestinian territory has been under military occupation for more than 56 years, an occupation entailing the creation of a humanitarian crisis lasting decades. Therefore, more humanitarian-only framing of what Gaza needs and its future is surely wholly insufficient, especially during a genocide. There is no Gaza to go back to. We must understand that the urgency was already existing before October 7th, 2023. As a South African, a child survivor myself of a brutal colonial and apartheid regime, and now an adult with a mandate of the UN Special Rapporteur on the Right to Health, I know that, like my life, the future of Gaza and the Palestinian peoples, and the future of people everywhere, cannot depend upon a series of perfectly aligned miracles. The right to health is an inclusive right and is a compass for us all. As a practicing medical doctor, I know the long-term trauma that the people of Gaza, its children, will carry with them because of enduring intergenerational physical and mental health impacts of racism, structural discrimination, violence, and imperialism. The ongoing escalation and displays of aggression by Israel in many forms as an occupying power represents continuous crushing moments of ongoing Khorasan, gross structural, systemic, and sustained violence. Just days into the war on Gaza, the medical infrastructure was irreparably damaged. Healthcare providers were working on a dire situation with limited access to medical supplies under conditions that did not allow them to provide timely and quality healthcare. They themselves as healthcare workers under bombardment in the enclave. I bear witness as the very practice of medicine is under attack, and this has been a war on the right to health from the beginning, as well as underlying determinants of health. The health system in Gaza has been completely obliterated, and the right to health has been decimated at every level. The conditions are incompatible with the realization of everyone to the highest attainable standard of physical and mental health. The attacks, the harassment, the killings of many of my own colleagues, the healthcare workers, the destructions of health facilities, and the destruction of humanitarian aid organizations continue to catapult to proportions yet to be fully quantified, if at all possible. Not only is Israel killing and causing irreparable harm against Palestinian civilians with its bombardments and their allies, they are also knowingly and intentionally imposing famine, prolonged malnutrition, and dehydration. I remain concerned at the ongoing risks of water and airborne diseases, lack of medical and surgical supplies and commodities, and the lack of sexual and reproductive health and mental services. The many, many complex injuries and resulting disabilities and complications created as a result of the type of military arsenal used puts disability rights also into focus. The number of widespread violations of the special protection afforded to civilians, including the horror that children are specifically subjected and exposed to, and violations related to lack of protection of medical personnel under international human rights law and international humanitarian law has been immeasurable. The International Court of Justice found it plausible that Israel's acts could amount to a genocide and issued 6 provisional measures, ordering Israel to take all measures within its power to prevent genocidal acts. And I speak to you today that even those have been ignored. Despite international calls and demands for an immediate ceasefire, the shameful war continues, and Israel's allies continue with the despicable acts of international cooperation in ways we've never seen before, and supporting to occupying in a regime with billions of dollars in aid, weapons, political power, and cover from accountability, to continue its destruction as an occupying power, to enact a genocide documented in real time by its victims. Leaders within the multinational system, regional blocs, academia, civil society, philanthrocapitalists, and leaders in global health must abandon their strategy of a self-imposed passiveness and the so-called quiet diplomacy. People are dying. I call on you yet again to use all powers and authority vested in you to not perpetuate the pacification and the genocide of the people of Gaza. In an urgent appeal I made to the Israel government dated 4th December 2023, I continue today to appeal to them for immediately to cease fire and to adhere to all the laws, norms, and standards enshrined within international human rights law and international humanitarian law and obligations under the right to health. All immediate and future interventions aimed at peace mediation and lasting solutions to peace must center the restoration of dignity of the people of Palestine and immediately deep analyze and go into recovery and rebuilding and resourcing of a health system to be able to provide accessible, acceptable, affordable, and quality care. In the context of the prevailing violence, the right to health is rendered unattainable. All the United Nations member states must also adhere to their obligations to prevent a genocide and also to prevent the right to health violations and ensure redress. Reparative justice will require a profoundly different approach and solidarity, as well as a caliber of world leaders who, unfortunately up to now, continue to display their moral, political, and diplomatic bankruptcy, and they must carry this genocide with shame. To all the oppressed people everywhere in the world, exploited, humiliated, brutalized, and colonized, I fulfill my mandate on the right to health, viscerally aware and understanding the compound crushing weight of the structural nature of the issues that you face. I share in the rage and in the fury of so many people around the world. I am ashamed and deeply sorry that the world has failed you. I hope that one day we will share different collective connection as humanity in a future that isn't based on the experiences of colonial imperialist trauma, of what it has taken from us and our peoples, our lands, and our collective future. Through my mandate of the right to health as the UN Special Rapporteur, I will continue to use the tools and methods of work available to me. I continue to be unreasonably hopeful that the realization of the right of everyone to the highest attainable standard can be promoted, fulfilled, and respected. I remain in unwavering solidarity with all healthcare workers and aid care workers in Gaza and all the areas of the world that experience conflict and protracted war. The oath takers, the ones who stay and continue to stay, knowing that death awaits them. Justice will prevail, and you will return to build your beloved Gaza, albeit through glistening eyes and your burning flesh and amputations, thirst and starvation. We bear witness to your collective, indestructible human spirit. However, you did not have to experience all of this for us to see what resilience looks like. The human desire for freedom can never be extinguished. To the children of Gaza, it is my hope that one day we can be worthy to speak your names. The martyrs of Gaza scattered across the strip with faith like a mustard seed. I keep the demand. Let it cease, let it cease, let it cease. The right to health at all levels, clinical care, health systems, and underlying determinants of health demand conditions conducive for the equal opportunity for its realization and for a life of dignity. Peace follows liberation. Cease fire now. I thank you.
Thank you, Dr. Tlaleng, for those remarks, and we'll move on to questions now. Start with questions from the room, and just state your name and organization before you ask a question. Thank you.
Thank you very much, Nina Larson from AFP. When you mentioned that you said this has been a war on health from the beginning. If you could say sort of in a bit more in detail what you're talking about there, and also if you could say a little bit about the hospitals. I know that over the weekend in Nasser Hospital, they say they found 50 bodies. Shifa Hospital, WHO described a few weeks ago as an empty shell filled with bodies. If you have any details on that, I don't know if you have any insight into what's been found in these hospitals, that would be helpful. Thank you.
The Special Rapporteur will take a few questions and then maybe, yes.
Thank you for this briefing. The first one is not really a question, just can you send please the notes that your statement, I mean your opening remarks to journalists, because there is a lot of interesting things. And my second question is more concrete. You spoke about a genocide about 3 times in your opening remarks. Can you today say that what you see in Gaza as a special rapporteur is a genocide? Yeah, ongoing. Thank you.
Thank you very much. So the first question I think is important because as part of the mandated work of being a special rapporteur is to engage with member states outside of our annual reports, and I do that as well based on reports that I get of either allegations of future rights violations or ongoing rights violations or historic. And so since I took over my mandate in August 2020, I have been engaging with the Israeli government on various interventions, trying to appeal to them, for example, allow children and adults with specialized medical needs, for example, for oncology, to leave the strip to get better health. The other interventions, of course, have included in the past this letter that I had written to them in December, detailing already the kinds of reports we were receiving on the ground through various UN agencies on the kinds of destructions that were happening, specifically around clinics and hospitals. But what was also very interesting at the time, when the journalists were being killed and we had seen those numbers rising, we were having at the same time the number of doctors, ambulances, and other allied and aid workers also being killed. And so the immediacy of my concern around the right to health was because of those early reports that were coming, that in fact ambulances were also being barred from entering particular neighborhoods to try and assist people who needed care. And as we know, the right to health is not just about facilities and hospitals. It's also about the underlying determinants of health. And so access to nutritious food, access to water, access to quality medicines have been a concern before October 7th. And so this particular episode is actually magnifying and worsening what was already a humanitarian crisis. We also need to remember that Gaza was already receiving enormous amounts in humanitarian aid in refugee camps. The largest open-air prison has been declared, and we've heard about it being called as such. And so the medical concerns have been, at least for myself, at least from August 2020, but the mandate has dealt with various accounts and dealt with the member state directly on those. In terms of, is this a genocide? Yes, this is a genocide that we are witnessing in Gaza. Thank you.
Yes, Gabrielle.
Reuters News Agency, Gabrielle Tétrault-Farber. Just a question about medical evacuations from Gaza that you mentioned. Have you seen any evidence of factors such as people taking advantage of the situation to make money off the medical evacuation business from Gaza? Is that something that you have seen in your mandate? And what factors have influenced those who are selected or eligible for such evacuations? Thank you.
So the mandate has previously been involved, and this is before October 7th, with making a case, right, based on international human rights and the right to health, why certain children, for example, should be granted the pass to leave Gaza, but also why they should be accompanied by their parent. In many instances, there has been this separation of children from their parents or caregivers when the children need help themselves. The issue of money making, I'm not sure about where that comes from, but I do know that since October the 7th, there's been a lot of civilians and global solidarity directly and specifically raising money to help people with medical needs, with securing food, menstrual health and hygiene products. We know that women have been giving birth in Gaza. The most reported has been, cesarean sections being done without anesthesia. But there has been a lot more global solidarity after that event of October the 7th. And I can speak to that, the solidarity has been people raising money through organizations as well, and through the UN agencies as well. And that's why when the UN mandate itself is being limited and threatened in the way that UNRWA was, it's a huge concern, because if the UN and its own agencies are unable to afford and give support to people experiencing this level of violence and trauma, then who can go in there? And so I think for me that's what's really important, is to continue to demand that member states support the mandate of the UN and its agencies on the ground in Gaza, because again, we need information. We need timeous information, and it's through those agencies and the work of colleagues on the ground that we can actually get it. And I mean, one of the first casualties in this war outside of healthcare workers was the killing of our own colleagues at UNRWA. So we know the defunding that happened to UNRWA as well. All of those conditions create people to become opportunistic. And although I cannot speak, I do not know the facts of money making, but the conditions created in terms of the border controls have absolutely, one can imagine, create those opportunities that are unsustainable, but also incredibly unfair on people as well.
Nina? Sorry.
Yes. Sorry, I just wanted to follow up on the question I had on the hospitals. I don't know if you have any details on what's going on, what's been happening inside the hospitals, Shifa and Nasser, particularly where there's been talk about a number of dead bodies that have been found there when WHO teams reach. And also, I just had a question about you spoke about your interactions with the Israelis since you took over your mandate. What kind of response are you receiving, and have you had a chance to visit, or are they in contact with you now? Thank you.
So the member state is overall unresponsive. I'm still waiting for an engagement on that urgent appeal that I made. I have not visited Israel or the occupied Palestinian territory. In terms of the follow-up of the health facilities, we know that with the 1.7 million people who are internally displaced, that does put pressure on the very few facilities that are already existing. And we know that at the moment we have WHO on the ground giving us statistics. In terms of fully functional hospitals, they were speaking of many field hospitals that they had to set up in response to the destruction of the hospitals that existed. We know with Al-Shifa, that massacre that happened that was also grossly underreported, as the world media, of course, has many demands on breaking news, that even till this morning, as we sit here today, there are many bodies under rubble that are still being found, many people who could have perhaps been saved if first aid and ambulances were able to reach them. The other important element is that when we are counting the number of people died, we also need to remember that there are already decomposing bodies of people killed already from October, which there has not been an organized way of retrieving those bodies, or at least even dealing with the amount of destruction that has happened. So on the one hand, we know that the healthcare facilities are completely dysfunctional. Those that are functional don't necessarily have all of the equipment and the medical supplies they require to meet the standards to provide quality care. And unfortunately, many of those hospitals have been sites themselves of violence where patients and healthcare workers were being harassed. And in some cases, we know that patients were killed in some of these attacks in the hospitals. And so the right to health has been in the spotlight, from my perspective, in a way that we've never seen before in the times of a crisis and a conflict, in that those protected sites under international human rights law and international humanitarian law have been bombed and attacked. And Israel has failed, firstly as an occupying power, but also as a member of the UN, to uphold those rights and meet their obligations.
Yes.
Beyza Dönmez from Anadolu. I would like to return to the medical evacuation topic and want to ask, especially as you say, many hospitals are not functional, and what happened to Al-Shifa and Al-Nasr. I want to ask, do we have any update on the medical evacuation situation? Is any happened in the recent days? How many people evacuated, with what? And also, I would like to ask, do you have any rough number of how many people urgently need medical evacuation to stay alive? Thank you.
So no, we don't have numbers of how many people need evacuation. I think the destruction of civilian infrastructure and civilian order is also what is problematic in the space, because if you can't record, you can't quantify, you can't report, there cannot be a sufficient enough response to what is needed. Hence the continued call for an immediate ceasefire. It's to allow for a moment for, firstly, immediate return to humanitarian support and aid. But in the long term, the work that needs to happen to repair the systems of just health reporting and health data collection is going to be a very big task. Right now, we know we have a lot of physician organizations on the ground. We have aid organizations on the ground. But to give you the numbers and hold anyone accountable to the numbers, we don't have those. But we know that a lot of people have been evacuated to the neighboring countries and the regions. And even that in itself takes extremely long to complete as a process. And a lot of it has been left to those who can raise funds and crowdfund to do that. There isn't a systemic, structured, focused, and a deliberate intent to ensure that people's rights to health are protected. The response is coming from people themselves crowdfunding.
So, do you have a follow-up?
Just a little one, short one. I just wanted to ask, you said that, many people evacuated, but I want to specifically ask, does any evacuation happen recently in the last few days? Thank you.
In the last few days, I can't give you an answer, but I know that 4,373 patients have been assisted through the WHO work, but not as of yesterday or Saturday, that I can't give you. But there has been evacuation. The approval rate is 47%, which is very low still, if you account the types of injuries that are being seen at the moment. And I mean, the point is that Gaza should not be evacuating people for support, right? These facilities and the health services should be able to adequately respond to their needs where they live and where they reside. So the medical evacuation is also just another layer of support, but it's not a permanent solution to what is needed. And we're already struggling with evacuations even before October the 7th. But the WHO and other agencies have been supporting with evacuations.
Just one more follow-up about the health workers in Gaza. Do you know how many health workers have been killed, have disappeared, or have been arrested since 7th of October? Thank you.
I think, again, with the data, it's important to underscore that we have what's been reported, and a lot of what is missing is yet to be truly, truly uncovered. We know that 520 healthcare professionals have been injured, and we know that 350 healthcare professionals, including allied healthcare workers, have been killed. 350 have been killed, and 520 have been injured. And remember, these, in my view, are gross under reporting. And if you define who a healthcare worker is, we have children now in Gaza who are volunteering in hospitals. And they won't be counted as healthcare workers, right? They are children. But we have them working as first aid responders as well. And so there is a lot of complexity around just even analyzing properly who's a healthcare worker and who's accounted for. But that's the situation, that you find children having to take on the incredible task of being first aid responders in hospitals and clinics.
Thank you. I'm just going to ask if there are any questions online, because the Special Rapporteur doesn't have much time left. If there's anyone online that has a question. Christiane. Sorry, we're having some technical difficulty.
Perhaps a follow-up on the healthcare workers. We do have reports of healthcare workers who have been harassed, who have been tortured and imprisoned, and those will emerge in further details because they need proper investigation. I think there's another question that you had asked earlier on, including some of the directors of the main facilities in the hospitals, many of them who refused to leave and follow those evacuation orders early on. And we know many of our own colleagues were dealing and responding to their own families coming in, after they had been injured. So it's a real traumatic space to be in. When you are an oath taker, you stay, but you know what that means when you could have been evacuated. And I think that says a lot about the commitment of healthcare workers in Gaza.
Yes, Nina.
While
Last
you're
question,
waiting.
maybe.
Sorry, I just wanted to clarify on the numbers that you provided on the numbers of healthcare professionals injured and killed, where you're getting those numbers from, and also you had some other percentages and stuff earlier.
There's a database that the WHO has that is live, we can share the links to those as well with you. And of course, there are other, aid agencies like UNFPA who've been reporting more on the sexual and reproductive health side of things. The many maternal deaths that we see, the kinds of postpartum sepsis that we see, but also related to that is the neonatal deaths, where we saw the many children dying in incubators, who were also, affected by the bombings that were targeted at the hospitals themselves. We also remember that many of those newborns could not be evacuated, in fact. And so we do know that there is many different agencies providing the data, and I've got the links that I can share with you to the WHO international website for that.
Yes, go ahead.
Actually, my question, I'm Dina Abisab, a reporter of different Arabic media. My question is about the mental health of children based in Gaza after more than six months of attacks. Can they find any healing solutions maybe after the end of the war? We know that the war was very severe. What's the current situation, and how bad will be the future of those children? Thank you.
Thank you very much. And this will be the last question. The mental health aspect of it continues to be of concern. And I think it's important to realize that this is an acute episode on top of a chronic issue of mental distress and anguish that was already existing. It was never normal what Gaza was before the October 7th, which is why I keep saying that as the world thinks of a peace solution, lasting peace, and a ceasefire, our imagination cannot be limited to what Gaza was before, because even that had multiple violations of human rights. And so mental health, intergenerational trauma, the kinds of acute assistance, medical debriefing, psychological debriefing that many children still have not received is of serious concern. And often, of course, we see the physical injury, and because it's physical, one can appreciate the severity of it. But the acute mental distress that will then turn into anxiety and other kinds of mental illnesses later on in life is really, really important to start thinking intentionally about. And all of the support should be accompanied by psychological and mental health practitioners who are specifically, with expertise to support in these kinds of contexts. Imagine living under the constant anticipation of a bomb, of a gun, of being shot while you're trying to get food or water or play. That is in itself a form of violence, to anticipate that your life could be distinguished in any moment. And for children to grow up with that level of trauma is not normal. But for decades, that has been normalized for the people of occupied Palestinian territory. And I'm saying that October 7th is an episode amongst the many in which the world leaders have let the people down. And how we move forward from here should be really comprehensive, and we ought to understand that the current state of the violence in Gaza is completely incompatible with the right to health. And so one way of moving is to really put the right to health in front, because it's so inclusive. It talks about underlying determinants. It talks about what should be happening in facilities, in clinical care. But it also talks about health systems. And that's where the politics are. And that's where the UN itself finds its power and authority. It's in that political, diplomatic space. And we ought to do everything that we all have to be able to respond adequately in this moment of crisis.
Thank you. We will now wind up this press conference because the Special Rapporteur has another engagement. Thank you for your interest in the work of the Special Rapporteur, and we will make arrangements to send the opening statement around after the press conference. Thank you so much for joining us.